Probably for a simple tonsillectomy, no. For a radical tonsillectomy, you'll see it, but not for a simple tonsillectomy. This is not probably the case for it. You probably won't see any arteries.
So I'm barely touching this tissue.
Yeah, so any tips for, we have a little bit of a problem with charring and, a little bit of char collecting. And I find that you don't have any of that on your spatula. So do you have any tips for us for that? Because trying to get the char out is a troublesome process.
Yeah, so charring happens in a couple of instances. So when you're doing tongue-based surgery, when you're first cutting through the tissue, the tonsillar lymphoid tissue, you'll get charring, always get charring.
Correct.
And you have to wipe that off. It's unavoidable. Second time you get charring is if you bury your tip too far and you're exposing too much of the tip to the tissue. The third time you get charring is if you have bleeding. So as long as you can keep your wound dry, there's very little charring that happens. So those are the three tips I have about charring.
Yeah.
And the other thing is I've kept my Maryland in one spot the entire time. I'm decreasing my crush injury to the tissue. The more times you grab the tissue, the more times you'll have crush, and then you'll bleed more just from the crush injury. So now, but because I'm down here,
do you think using a grasper reduces this crush injury? Because the Maryland has a sharper tip. Well, Maryland is a small forceps.
It is, and in oncologic surgeries, I actually don't grab as much. I use my Maryland as a retractor by pushing like this. So my tines are open, and I'm retracting this. I'm using this almost as a rake, where I'm pushing the tissue, and I don't grab as much.
Right. So the forceps on the left, there's a question from the audience regarding the instrument. So I just thought I'll just tell them that the forceps on the left is called a Maryland, and it's pretty similar to what you use in laparoscopic surgery. And what's on the right is a spatula, which is having the cautery attached to it.